Tori are considered benign bony growths that develop commonly on the inner surface of the lower jawbone, known as mandibular tori, or on the palate, known as palatine tori. They can also develop on the outside of the jawbone, in which case they are called exostosis. In this episode, I'm going to share with you the key indications for the removal and the current atraumatic techniques that promote the healing process. I'm Dr. Kazemi, and welcome to Hints and Tips in Dentistry. Mandibular tori, palatine tori, and exostosis can develop into various sizes. Now, while they are benign, they can grow very slowly over time, often due to continued irritation during normal chewing. The most common reasons for removal of tori or exostosis are recurrent irritation, pain, and ulcers. It is also done in patients getting full conventional dentures to replace their missing teeth. Of course, this is much less frequent nowadays due to availability of dental implants to support teeth in fully edentulous patients. For diagnostics and planning, we first obtain a cone beam CT scan, which accurately shows the size and the extension of the tori or exostosis. This way, we can make measurements for precise removal of the bone while avoiding vital structures and adjacent teeth. For this type of procedure, I generally recommend IV sedation for total patient comfort. Now let's review the steps in surgical removal of tori or exostosis. The first step is to gently reflect the gum tissue over the bony growth. The gum tissue is very thin over the tori or exostosis, so it has to be done very carefully in order to avoid tears, which will complicate the healing process. To remove and recontour the bone, we use a piezotome, which is an ultrasonic tool, and it allows for a gentle and atraumatic removal of the bone. It is used for both initial removal of the excessive bone as well as for fine recontouring. The procedure typically takes about 10 to 15 minutes for each tori. Next, we prepare PRF or platelet-rich fibrin membranes from patients' own blood. We then place the PRF membranes on top of the bone and cover it with the gum tissue. PRF helps greatly with maturation and faster healing of the gum tissue. And finally, the gum tissue is stabilized with dissolvable sutures. There is usually minimal discomfort for a few days, which is readily managed with over-the-counter pain medications. The initial healing takes about 7 to 10 days as the sutures gradually dissolve. The removal of tori or exostosis is a safe and predictable procedure when they are accurately diagnosed with a cone beam CT scan, removed with conservative piezo techniques, and use of PRF membranes for promotion of healing. So if you're experiencing recurrent pain and traumatic ulcers related to tori or exostosis, removal using the techniques we discussed will bring you definitive relief. Thank you for watching. I'm Dr. Kazemi, and I look forward to seeing you again soon on our next Hints and Tips in Dentistry.